Well, the West Africa Drug Policy Network, with support from West Africa Civil Society Institute and the Open Society Initiative for West Africa, OSIWA, will be organizing public dialogue forums through television and radio platforms in 5 targeted countries: Benin, Ghana, Cote d'Ivoire, Liberia, and Sierra Leone. This is to engage community citizens on the necessity to have drug policies grounded on human rights, public health, and harm reduction. The public dialogue forums will attract an audience of citizens from all walks of life to increase their understanding on the matter and empower them to advocate for public health approaches to drug-related harms. The overall objective of the public dialogue forums through television and radio platforms is to engage community citizens and government officials on approaching drug policy formulation, compliance, and implementation from the human rights and public health perspectives. Well, in the studios to talk more on this is Yao Akasi Sapong, and he is a member of the West Africa Drug Policy Network. Good morning, Mr. Akasi Sapong.
Thank you very much.
And
good
welcome,
morning.
welcome to the program.
Thank you very much. Good morning. And
now, let us know the motivation behind this, because it has taken years now since you've been in this campaign, trying to let countries have, drug policies, but not too harsh, but can really lead to you achieving something out of whatever comes up as policy and policies. So let us know the motivation behind this particular campaign at this particular point in time.
well, the United Nations would normally have a special session of the General Assembly when there is a world problem. It could be refugees, it could have been Palestine, it could be terrorism, it could be corruption, it could be money laundering, it could be children's welfare. But the one world problem which has gotten the United Nations to have 3 sessions is the world drug problem, which means really that for the world international community, the world drug problem is a big challenge. And the 3rd one was held last year in April 2016. And in the run up to that, there were a number of questions asked about whether or not the present legal regime on fighting drugs is working. The first convention was 1961. The second convention is 71. And the third convention is 1988. In fact, it was only in 1988, in the 1988 convention, that countries were required to use punitive measures on all types of, on all activities involved in the drug market. So it is in the run-up to the 2016 UNGAS that civil society internationally and even government officials and former international diplomats, Kofi Annan, former Secretary General of the United Nations, a member of the Global Commission, he set up the Kofi Annan Foundation, also set up the West African Commission on Drugs, came out with other world leaders and said, look, this our campaign on drugs is not working. Obasanjo, His Excellency, former Nigerian president and twice head of state, is the chairman of the West African Drug Commission. And in their report of 2014, what did they say? They said, it is not drugs that are killing people. It is bad policies that are killing people. And we think that governments must engage civil society, because in many areas, civil society knows the issues better than government. The fact that somebody is in government doesn't know he knows an issue better. So we think that as civil society, we think that we need to engage governments because they have the final responsibility. We need to engage them and say, look, the war on drugs is not working. So all we are doing is that we are opening the debate. We are not saying that tomorrow the policies will change, but all we are saying is that we need to engage more stakeholders.
No, Mr. Akrasi Sapong, you said it is not drugs that is killing people. But it's about the policies.
Thank you.
The policies on drugs.
Policies.
Now let us know, really, for the benefit of the viewing public. What really do you mean?
Yeah. What I mean is this: that the records are very clear. Let me give you an instance. When we say drugs, in this context, most of us are talking about narcotic drugs. In this context, but the context is even broader because people use, for example, in Sierra Leone, in Ghana, in other countries, people misuse tramadol, which is a illicit drug. So people also misuse pharmaceuticals, which are illicit drugs. So let us just say for now, let's talk about narcotic drugs.
Even here in Sierra Leone, tramadol is a problem.
Thank you. In Ghana too,
Oh.
in the sub-region. So let us limit it to narcotic drugs. Compare cannabis to tobacco. Tobacco is a drug. Compare it to alcohol. Alcohol is a drug. Now, alcohol kills more than cannabis. Tobacco kills more than cannabis. But because there's an international capital lobby, we tend to legitimize tobacco and we legitimize alcohol. So why are we not looking at the possibility of decriminalizing, for example, cannabis use and possession? A policy that punishes people who use cannabis or possess it in small quantities is killing people. In other words, somebody holds a joint, you arrest him and put him in jail, and then the state feeds him more than he has paid for the joint. Secondly, his human rights are abused. He's in remand. And the law is very clear. If somebody is in remand, you cannot put him where the convicts are, because in remand, he's not guilty. And yet you put those who are in remand together with those who are convicted. And this is not just Sierra Leone or Ghana. It's right across the sub.
So the person in remand, Mr. Sapong, the person in remand,
yes,
now becomes more hardened.
He becomes more hardened. He gets sick. He learns other techniques. He thinks that the whole society is against him. His family is broken and taught. And the family may even have to go and pay bribe.
So there is this argument also, Mr. Sapong. There is this argument that starting from cannabis, it's like you graduate from cannabis. Probably you will now graduate to something like cocaine or ground, as the case may be.
Unfortunately, in West Africa and in Africa, the elite, particularly the intelligentsia, we try to promote false perceptions because it suits us, because we benefit on the ignorance of the people. I would wish that I was here with, I'm a pharmacist and a lawyer, I would wish that I was here with other people, and they should come and prove to me that cannabis leads to cocaine. I mean, that is a falsity. It has been challenged. I mean, the evidence is that it has been challenged. There are people who use cannabis and have never gone to cocaine. There are people who use tobacco, they never went to cannabis. So this perception, in fact, in Ghana, for example, we call cannabis abonsam tawa, that is the devil's tobacco. I mean, look at the perception. The perception is that cigarettes is white man's tobacco, God's tobacco, but cannabis is devil's tobacco. Or you see people using cannabis, they say, oh, the guy is a madman. I mean, I'm saying that when somebody is smoking cigarette, it is more of a crime for governments and the international community to legitimize alcohol and tobacco and then criminalize cannabis.
So now, Mr. Sapong, now what are you really advocating for? Do you want cannabis to be also legitimized, just like alcohol and tobacco?
Well, you see, that's what we're calling for, because we have a cultural context.
Okay.
We have years of programming our people to believe that cannabis is bad, and we need to be clear about our cultural context. All we are saying is that let us begin the debate. Let us look for other ways by which our policies would improve. We have scarce resources. If the Sierra Leonean police has $1 million, are you going to say that they should use $20 million, $20,000 to arrest petty peddlers and those who use. Let us target the big farmers. Let us target the big traffickers. That's what we are saying. There are scarce resources. Let us use them in smart criminal justice. So that, for example, if somebody is caught with a joint of what's it called? Of cigarette, of cannabis, all we are saying is this: that don't give him a criminal record. You could warn him first. Second, you give him a criminal caution. Third, you fine him. Fourth, you put him in a community work. You know, those are the type of things, because we are overburdening the criminal justice system. We are overcrowding the courts, the prisons, and we are not helping their human rights.
And we are also delaying justice.
We delay the justice because it suits us just to lump them as remand prisoners.
Okay, now, Mr. Sapong, you are saying that, based on what you explained, if only I've been able to understand you well,
Sure.
is that instead of targeting peddlers, or those who smoke cannabis in very small quantities, let them target the bearers, the big guys.
The big guys. We need to target the big guys. First of all, as in every African country, how many big guys are in prison? Those who farm the thing big time in traffic, how many of them are in prison? And how many of the peddlers and smokers are in prison? When the statistics come out, it is a disgrace to policymakers. It is a disgrace, a farce. It's against our human rights. So you see, the indicators are that if you arrest 100 peddlers and you sensationalize them in the newspapers, then government is doing well. No, that is not a measurement.
But the police is working.
Yeah, the police is working. You see, it's not the police it's not so much as the police, as the politicians, the policymakers. Bad policies are good politics. If you arrest 100 weed smokers, that is good politics. But it's bad policy. What we are saying from your introduction is that let us move from the punitive measures and take advantage of the conventions and say, look, target the money launderers, target the traffickers, target the big cultivators. But for the others, let us start a humane, compassionate, public health centered approach. In other words, if somebody is addicted to tobacco, you try to treat him. HIV. The HIV campaign is a lesson for us. The HIV campaign shows clearly that when you have a campaign where the arguments are clear and the message is precise, it can win people over. When HIV started, people were distributing condoms. The faith-based organization would say, how can you distribute condoms to children? Today, even people in the Catholic Church which is against the condoms understand that that is the best way of preventing HIV. And that is the point. We have a problem. All over this year, 50 years plus, we've not been able to eradicate all the farms in West Africa. So what does it mean? It means either we are allowing the police to be corrupt, or our policies are bad, or both, or the resources we are misusing our resources, or all three. So it is important.
There are times in Africa when exhibits. Let's say, for example, the police have gone to a farm, a very big farm, a cannabis farm, and they kind of took a large quantity of cannabis to the police station, and all of a sudden, that large quantity of cannabis, started to dwindle, and in fact, in some cases, the cannabis will also disappear. So the question is, let us now know the location of this cannabis. The police took from a very big cannabis farm, taken to the police station, and all of a sudden, probably you as a media practitioner, you go to that police station and they tell you, we burnt it, but they will not show you where the burning took place.
Yeah. Well, I mean, I don't want to comment on whether this happened in Sierra Leone. I don't live here, but in Ghana it has happened before. And it just clearly tells you that.
I'm talking about West Africa.
I'm not talking about Sierra Leone. Okay, yeah. So in West Africa,
this campaign is a campaign
for West Africa. Sure. So where that happens, we should be taken aback because it's just a sign of corruption, a clear sign of corruption. It also means that we have a wrong policy. You see, when you do the arrest, media houses, journalists must trace from the arrest right through to the courts. Because in some countries, if the court does not order a burning, the police cannot burn. One. You see, if you allow the police to arrest, first of all, when they do the arrest, the police must tell us. It is the right of the public to know how much is seized. If they seize 1 ton,
it must be done publicly.
Thank you. If it seized, and then when they take it to court, it must be. They must tell the court. In the court, they must weigh and know it's one ton. And when the court gives an order for it to be burnt, the media must be part of the burning, and the public must know that the thing. That is these are the ways. These are the ways to stop corruption in law enforcement. Because corruption is not just with politicians or law enforcement. It could also be with other public sectors. So what we need to do is to ensure that the bar of anti-corruption, accountability. Well, sometimes I prefer to use the word accountability and integrity building than corruption. Corruption is too negative. If we can build accountability structures, if we can build transparency, invariably, people will stop impunity.
Okay, now you've started this campaign. In this campaign, you are targeting, the countries that I named, a few minutes ago. Benin, Ghana, Cote d'Ivoire, Liberia, and Sierra Leone, using the media, like you are doing right now.
Yes, sir.
So, are you only going to depend on the media for this campaign, or you are going to reach out? You are going to engage, policymakers, government officials, because all what we are saying as a civil society activist, it will come to nothing if the politicians, the policymakers are not engaged.
Well, for all you know, I'm aware that the message is getting very, very close to politicians. I'm aware that the message is getting very close to politicians. Our ears are on the ground. We network with a lot of politicians. We network with a lot of people, out there. And we know that politicians themselves are thinking about the policies all over. The reform policies, they are thinking about it again. In many countries in West Africa, they are beginning to see that resources are scarce and prisons are being overcrowded. So in many countries, I believe even in Sierra Leone, because I'm told that the Minister for Interior made some comments on 27th June when they launched the World Drug Day, the comments about looking at your laws all over again. Well, you see, so that it is important to say once again that when we talk about policy reform, we're not talking about legalization. We are talking about public health centered approaches, shifting the focus and resources away from punitive measures for possession and small cultivation. For example, we are against public smoking of cannabis in public. But imagine that I have a pot of cannabis in my house, and I grow cannabis, and I use it for my recreation in my room. It is like drinking alcohol in my room. Why should that? So then you allow a policeman to come to my room and say because it's on the law books, he comes to arrest me in my house. I mean, it's a waste of resources. Again, let me say that drug policy reform, simply put, is saying shift the resources away from unnecessary criminal justice law enforcement approach for small users, non-violent offenders, put them under administrative fines, and move toward the big-time traffickers, and then give more public health.
Mr. Akrasi Sapong, you mentioned earlier that the big guys are not in our prisons in West Africa. Those who are trafficking, those who are the large cultivators, they are not in our prisons. But the peddlers, the small quantity users are the ones you see in prisons. Mm-hmm. So it is like, how do you think this narrative could be changed?
Yeah, that's what I'm saying. If the narrative is simple, that's policy. Law is policy in legal language. So all that they have to do is to do an amendment to the law and say no, or give an instruction to the police. Henceforth, nobody who is caught with a pet should be sent, what you call police diversion, should be sent to prison. You book the person, you call the parents, you advise them. There's a committee. I mean, Portugal has an experience. They call it the Dissolution Commission. So the people come. You arrest somebody. When you arrest a person, there's a commission, a social worker, an attorney, a psychiatrist. You assess the person. Is he a problematic drug user? Yes. So you then encourage him to go into treatment. Because if someone is a problematic drug user, he's an addict, and you put him into prison, you are going against his human rights. He has a right to health. He has a right to health.
You are saying, as part of this campaign,
yeah,
you are suggesting that governments in West Africa establish rehabilitation centers for these addicts.
Government should encourage, because it's a PPP thing. Okay. Government has private sector
or public private.
They should encourage people.
Okay.
And I dare the churches, particularly the churches. Everywhere in West Africa, you see big banners. Let your gate be open. Prosperity messages. I'm daring them that they should, in 6 months, go on a fast and prayer and see whether everybody will stop smoking marijuana. Everybody will stop smoking cigarettes. And they should stop deceiving us. This is not a moral issue. It's a real issue. Sin is not going to get out of this world. And so they should stop demonizing people. And just say, if Jesus were here, he would treat addicts and get to the cause. And I'm saying that let us leave this demonic gospel message and stop demonizing people and just go back with compassion. It is the church and faith-based organizations. How many faith-based organizations in this country have rehabilitation centers? That is their business. That is what they should be doing. They should be reaching out to the smokers, giving them a message of hope. Let them give them a message of hope. If you walk through every street in Sierra Leone, in Ghana, when people go to church and they praise, they come back and live in squalor. They come back and live in mad situations. Is that gospel? Let us stop. There's a reality. The reality is that there are people who are problematic drug users. Let us take them to church. Let us take them to rehabilitation centers. Let us take them to treatment centers. Let us counsel them. Again, we are calling on West African governments to do research in cannabis. Look, before 1830, most of the paper in the world, tapoli, masks, were from hemp, ropes. We can look, West African countries can be independent of the IMF if we develop the cannabis industry.
Okay. Thank you so much. And he is a member of the West Africa Drug Policy Network, and he is Yao Akrasi Sabong, where he spoke like a real ECOWAS citizen, like a community citizen. Because he was speaking to Africa, West Africa, to be very specific, and he spoke as though he is a Sierra Leonean, he's a Ghanaian, he's a Nigerian, he's a Liberian,
West
African. So he's a real community citizen. Thank you so much.
And we should start thinking of ourselves as West African.
Yes.
If we think of ourselves as West African, if we think of ourselves as African, the US plus China are not more populous than us. Okay. They are not richer than us.
Okay.
But when we divide ourselves as Sierra Leonean, Ghanaian, then we are divided. We are richer than China. We are richer than Europe. We are richer than America.
It's a matter of just,
let's get together.
It's a matter of implementation, Mr. Spunk. It is a matter of implementation. There's already, protocols. The ECOWAS protocol of free movement of persons.
That is right. It is free movement of persons, not free movement of governments.
Okay. Thank you so much. And thank you. Well, you've had him. Well, and he is a member of the West Africa Drug Policy Network, and he was also the former head of the drug policy
Narcotics Control Board
in Ghana.
And whilst I was head, I started calling for reform.
Okay, thank you so much. The program you're watching is Good Morning Sierra Leone, live on the Sierra Leone Broadcasting Corporation. We go for a very short break. When we come back, Good Morning Sierra Leone continues.